Hello everybody, this is Andrew Cosman, physiotherapist with ADM Ottawa Physiotherapy. Today we are having our second talk on the subject of fall prevention. Last month we started our conversation by defining what a fall is. We talked a little bit about the consequences of a fall, mostly that of losing independence in one way or another. And we talked a little bit about the vicious cycle that exists when somebody falls, where they have a fear of falling once they've fallen and stop moving as a result. And when you stop moving, you develop muscle weakness, and muscle weakness becomes a risk factor that can increase your likelihood of falling by 4 or 5 times, and thereby increasing your risk of falling when you actually do need to move. So on that note, we're going to start our conversation today with a discussion about what some other biological risk factors are. And over the next couple of months, we will take a look at different categories of risk factors that can influence a person's risk of falling. Now, as I mentioned earlier about muscle weakness being one such biological risk factor, other risk factors that exist are having cognitive deficits or visual deficits. Now, what both of those do is that they decrease your awareness of your surroundings. So, for obvious reasons, that does increase a person's risk of falling. Now, vision problems is an interesting one because there can be something that's a little bit more biological, but there could be some elements of that that are a little bit more environmental that we'll talk about in the future. One obvious one is having balance issues. Okay, people generally know when they do have a loss of balance. It's not uncommon to hear people say that I've never been really good with my balance or that my balance has been worsening. People generally are aware of balance, and what that does is it puts it in a category on its own. People know about flexibility exercises, people know about strength exercises, maybe even endurance exercises, but there are also exercises that are related to balance. So balance is an important category in and of itself. Having deficient or altered walking patterns can be a cause of having increased risk of falling for obvious reasons. But what might not be so obvious is to ask the question, why might somebody have a difficulty walking? The most obvious of those reasons include different pains that may crop up in the ankle, the foot, the knee, or the hip, or the lower back, and people are all of a sudden limping. Of course, for one reason or another, whether you're not lifting your leg high enough and so on, this might be an increased tripping hazard and so on. So dealing with those aches and pains may, in fact, be a way of decreasing a person's risk of falling. We talked a little bit about the balance issues. We talked a little bit about strength issues, and we talked a little bit about the gait pattern. An obvious one too is just decreased mobility. Like we talked about flexibility or mobility. A person who's just generally getting stiffer over time and not able to move their legs as much, not able to lift them up off of the ground as high when they're walking can be an increased risk as well. Now, a lot of these things tend to occur with advanced aging. Now, that's not something anybody can influence, but when somebody's trying to consider the risk profile and you want to enumerate the number of risks factors that exist, advanced aging and then comorbidities or other health concerns are among the things that we can ask or add rather to the list of items that can increase a person's risk of falling. Now, fortunately, many of the things that we mentioned so far, whether it is the deficient gait patterns, whether it is muscle weakness, mobility issues, balance issues, in some cases vision problems, and to some extent cognitive deficits, there may be something that can be done in all cases. So while this is not intended to be the doom and gloom, the idea is actually the opposite, where by identifying these things that increase a person's risk, whether my own or that of a loved one, these are all things that, by and large, can be modified. So stay tuned till next time when we talk a little bit more about risk factors, keeping an eye on the ones that can be modified. If you have any questions, as always, you can reach me at 613-820-8765. Bye for now.